In today's Staying Healthy report, new statistics show more and more children are being diagnosed with autism. The cases are up 23% from 2006 to 2008.
It's quite a bit, so it has wanting to take a closer look at what causes autism and talk more about this. Dr. Dianne McCallister, the Chief Medical Officer at Porter Adventist Hospital, comes here every Wednesday to answer our questions, your questions. So let's start with the basics here. What is autism exactly?
The definition for autism is continuously being refined, but the current definition since January of this year is it's a syndrome of significant developmental delays associated with delays in verbal, nonverbal communication and social interaction, usually develops before age of 3, and it can cause difficulties with learning.
So let's say a mom or dad watching right now has a question, maybe a suspicion. How would you recognize that your child has autism?
Well, there are some behaviors that children with autism have more than normal children, and it can include such things as repetitive behavior like rocking and spinning, also delays in speaking, avoidance of physical touch or social interaction, and also things like repeating words and getting very upset with minor changes. Now, I'm a mother of 3, and I can tell you that many of these symptoms you also see in normal children, so it's a matter of degree and frequency.
So this study reported a 23% increase in autism over just a 2-year period. That sounds pretty big. Is it because we're better at identifying it, perhaps?
Well, yes, that's part of the reason. Prevalence is how many people have a diagnosis at a certain point in time. And definitely we've become better at recognizing autism and diagnosing it early. But there's about 50% of this increase, which is really fairly unexplained to date.
Is it random, or are there risk factors for autism?
It's probably a group of diseases labeled with one name, and there are some correlations. And so let me say that a correlation means there's a hint that it may be associated. So things such as 15 to 20% of children with autism have been identified as having genetic mutations. Parents who have one autistic child are more likely to have another autistic child. There's some association with older parents and with that infertility treatments, and then there's associations with things like valproic acid. And there's even some correlation with mothers who live near a highway when they're pregnant.
Interesting. So what's your advice for parents?
Well, it's very important if you see these symptoms in your children, or you have a suspicion, to make an appointment with your pediatrician as soon as possible and get more information, get a diagnosis, because there are treatments for autism, and the earlier treatments are started, the better it is for the child.
All right. Thank you, Dr. Dianne McCallister.
You're welcome.
If you've got a topic you'd like to see us discuss here on 7 News at 11, email 11 a.m. at thedenverchannel.com. You can also read the doctor's advice on our website just by clicking on Staying Healthy.